US immigration policy has created an environment where many families feel afraid, unstable and traumatized. While it may feel like there's little psychiatrists can do, Dr. Lisa Fortuna is here to argue that there are ways mental health experts can help ease this burden. Thank you for joining us.
Thank you for having me here.
So talk us through some of the steps here. So what are some of the causes of trauma for children sort of pre and post migration?
You know, often in this country, families come because of trauma in their home countries, and so there's a lot of trauma that they already may be coming with, and a lot of insecurity and anxieties. So when we have then immigration activities here in our country, that can trigger and worsen those situations.
I mean, I can only imagine what it must be like, but talk me through a little bit what the trauma that a child would face for facing a sort of forced deportation of a loved one.
Real fear
Right.
of being separated from loved ones and caregivers. And so children end up having trauma in the sense of separation anxiety, worries about not being able to have their loved ones or their parents take care of them to any degree in the future. And then what we had recently with severe immigration activity, you know, children were witnessing violent
Right.
capture, right,
Right.
of people in their community, their family members and relatives and neighbors.
Right. Now, how does all that ripple through the community itself?
Well, it has, you know, a big ripple effect. Children end up in families, the whole community ends up feeling very unstable and anxious. And so what we find is that it's a multi-layered thing, right? You have parents and caregivers and family members that are very anxious and stressed and
Right.
potentially not going to work, not letting their children go to school, children not feeling comfortable going to school. So it creates a lot of tension
Right.
and a lot of isolation and displacement of, you know, normal activities that children should be involved with, like school, primary care, sports.
Right.
Children weren't accessing any of these things, and the whole community was under tremendous stress.
I can also imagine that stress doesn't go away very easily. So how does that heal?
One of the things that I have found is that churches, community-based organizations, allies have been really supportive of
Right.
families, and they're doing it in a few ways that psychiatrists can be involved in. One is providing instrumental support for families who have lost primary breadwinners
Right.
because they've been deported. And so families and communities and organizations are coming together to support those basic and instrumental needs. And the other thing is providing social and emotional support. And that's another place where psychiatrists can be involved in networking with those organizations, and being able to provide mental health information about how we can address PTSD. And we can educate the community around how we can implement some of those things in partnership with community.
How important is it that psychiatrists don't feel powerless in all this?
I think there's several layers by which we can do something. One is obviously advocacy
Right.
and policy. You know, we are experts in being able to educate. And so we can do a lot of education on child and mental health and family mental health and how these things impact. And then finally, we can make sure that we're asking about these issues within our patient populations and support them and create those conversations, because often families feel very stressed and
Right.
ashamed and guarded about talking about these issues that are seriously affecting them.
Well, thank you so much indeed for joining us today. We really appreciate your time, so thank you very much.
Thank you so much.